Vets don't tell you this. Vets don't want you to see this. What if the medication helping your dog's arthritis could also silently damage their kidneys, or even be fatal for your cat if used wrong? Today I'm breaking down the most common veterinary NSAIDs, how they work, their risks, side effects, and which pets should never take them. NSAIDs, non-steroidal, anti-inflammatory drugs, are some of the most commonly prescribed medications in veterinary medicine. They help relieve pain, reduce inflammation, and improve quality of life, especially for pets with arthritis or after surgery. But here's the catch: these drugs can also cause serious side effects if used incorrectly. Today, we're breaking down 6 of the most commonly prescribed veterinary NSAIDs, what they do, who makes them, their risks, and crucially, when dogs or cats should not take them. How NSAIDs work. NSAIDs work by blocking enzymes called COX enzymes, specifically COX-1 and COX-2. These enzymes produce prostaglandins, which are responsible for pain, inflammation, fever, but prostaglandins also protect the stomach lining, kidney function, blood flow. So when you block them, you reduce pain, but you also remove some of those protective effects. That's why NSAIDs can cause side effects like stomach ulcers or kidney damage. Robenacoxib, Onsior. Robenacoxib, sold as Onsior and made by Elanco, is one of the few NSAIDs approved for both dogs and cats. It's a COX-2 selective inhibitor, meaning it targets inflammation more than protective functions, at least in theory. Used for post-surgical pain, short-term inflammation, risks and side effects: vomiting, diarrhea, reduced appetite, kidney strain, especially in dehydrated pets. Who should not use it? Cats with kidney disease, dogs or cats that are dehydrated, pets with liver disease. Important. In cats, it's typically only approved for short-term use. Long-term use is risky. Carprofen, Rimadyl, Carprev, Canadryl. Carprofen is one of the most commonly used NSAIDs in dogs. Originally developed by Pfizer, now widely manufactured. Used for chronic arthritis, hip dysplasia, post-operative pain, and OT, safe for cats. Why? Cats lack key liver enzymes to metabolize many NSAIDs safely, including carprofen. Risks: liver toxicity, this is the big one, vomiting and diarrhea, black stools, a sign of GI bleeding, lethargy. Who should not use it? Dogs with liver disease, dogs with previous NSAID reactions. Cats, this is critical. Firocoxib, Previcox. Firocoxib, sold as Previcox and made by Boehringer Ingelheim, is a COX-2 selective NSAID for dogs. Used for osteoarthritis, chronic pain management. Not approved for cats. Risks: gastrointestinal ulcers, kidney issues, vomiting and appetite loss. Who should not use it? Dogs with kidney disease, dogs on steroids or other NSAIDs. Cats again, unsafe. Deracoxib, Deramaxx. Deracoxib, sold as Deramaxx and made by Elanco, is another COX-2 inhibitor for dogs. Used for post-surgical pain, osteoarthritis. Risks: stomach ulcers, intestinal bleeding, kidney damage. Who should not use it? Dogs prone to GI issues, dogs with dehydration or kidney disease. Cats not approved. Grapiprant, Galliprant. Grapiprant, sold as Galliprant and made by Elanco, is different. Instead of blocking COX enzymes, it targets a specific receptor called EP4, the receptor responsible for pain and inflammation. This makes it more targeted, used for osteoarthritis in dogs. Benefits: potentially fewer side effects on kidneys and stomach, but still not risk-free. Side effects: vomiting, diarrhea, lethargy, not for cats, not approved. Dogs with severe liver disease. Cimicoxib, Cimalgex. Cimicoxib, sold as Cimalgex and made by Veterinarian, is used in dogs. Used for pain, inflammation, osteoarthritis, risks, GI upset, kidney strain, appetite loss, not approved for cats. Major safety warnings: never combine NSAIDs with other NSAIDs. Steroids like prednisone. This dramatically increases the risk of stomach ulcers, internal bleeding. Watch for warning signs: vomiting, black or tarry stools, loss of appetite, increased thirst or urination, lethargy. If you see these, stop the medication and contact your vet immediately. NSAIDs can dramatically improve your pet's quality of life, but they must be used carefully. The biggest mistake pet owners make? Assuming all NSAIDs are interchangeable or safe across species. They are not. If this video helped you understand your pet's medication better, hit subscribe and always talk to your vet before making changes. Your pet's safety depends on it.